Hi everybody. Did you know that in 2015 and 2016, obesity affected nearly 93.3 million people in the US? Struggling with my weight has always been such a serious problem. Just been a lifelong thing with me ever since I was very little, as long as I can remember. Um, that actually led me to be very interested in researching different types of bariatric surgery, and I've actually come to find that there are multiple different types of procedures actually now. Some examples of some may be the gastric band or the gastric bypass or even the gastric sleeve. They all basically produce the same results, but they're just different ways they do it and how much they all affect different health conditions differently. So to start, the Rowan bypass, the gastric bypass, is one of the most popular bariatric surgeries that are around today. While they all provide significant weight loss, the University of Siena actually found that the percentage of total weight loss in patients that underwent the laparoscopic gastric bypass was significantly higher than the laparoscopic gastric sleeve procedure. So I feel like this you might lose a little bit more weight with than maybe just the gastric sleeve, just for the simple fact of like what they're actually doing in the procedure. The gastric bypass is actually a procedure that involves creating a small pouch, and you take a small pouch from the stomach and you connect it to the small intestine, so they're like removing a portion of your stomach in a way. After a patient has this done, your swallowed food will actually bypass the majority of the stomach and go straight to your intestine. Patients all over the world have actually had tremendous success with this, and it's been a very successful lifelong commitment for many adults, and even like young adults and any age adults really can have this surgery. And it's actually, if you're very successful with the surgery and you put in all the work, it's possible to lose 60% or more of your excess body weight that you were planning to lose actually. Some benefits that are produced from this surgery would be the improvement on GERD and heart disease, as well as high blood pressure, high cholesterol, and type 2 diabetes is a big health condition that all of the bariatric surgeries actually help improve. In the same way, there's actually the gastric sleeve, which is just a little bit like a milder form of this bariatric surgery. This one is now very popular because it's actually very shorter. It only takes 1 to 2 hours. And in this procedure, the surgeon only removes about 80% of your stomach. So you're not left with a lot of stomach left, only 20%. But the surgeon will create a banana sleeve that it's like shaped like a banana that reaches from your esophagus all the way to your small intestine. This is actually one of the only bariatric surgeries that is reversible. The gastric bypass would be a lot harder to reverse. Just like the gastric bypass, tons of benefits can be taken from this surgery. Some of the benefits that you may experience post-op from this surgery would be improvement with sleep apnea, type 2 diabetes again, asthma, hypertension, and just joint problems. You'll be able to improve all of those with just getting all that extra weight off your body and off your bones. Last but not least, there are actually an abundance of myths and misconceptions about weight loss surgery, I feel, which kind of gives my reasoning behind picking this topic. One of the most common misconceptions that I've found were was that the surgery is very dangerous. And yes, while there's complications with everything. So it's really just kind of down to like the pros and cons and what the benefits that you're looking for are. In a study at George Washington University, it was discovered that this was actually the most common reason to decline bariatric surgery, was for the myth and the misconception that it is very dangerous. However, weight loss surgery actually has a very low complication rate when it comes to many different surgeries. It can compare to like a knee replacement or like a gallbladder removal or an appendix removal. Another popular myth would be that obese people are just lazy and unmotivated and just sit around and they don't try all the diets and everything out there, but that's not true at all. And even in my own case, I can say that that's not true at all. It's actually, in fact, a health condition, and there's many things that contribute to that, like genetics and hormonal aspects and psychological aspects as well. Furthermore, all forms of bariatric surgery can be extremely beneficial in transforming the lives of many, many people. Despite the myths and the risk associated with this surgery, it has completely just helped change people's lives and give it a complete 360. If you're feeling at a dead end or just have become completely miserable with your weight, I challenge you to contact your local bariatric surgeon to get your weight loss journey started so you can just feel better and have a great life. And thank you.